In 2014, the Senedd passed a law called the Social Services and Wellbeing Act, which came into force in 2016. This piece of legislation was created to improve outcomes for people needing care and support, and also for carers needing information and support when delivering care. Understanding the legal rights of carers in Wales requires an understanding of this Act. The Act defines a carer as someone who provides or intends to provide care for an adult or disabled child, and it puts unpaid carers on an equal footing with those they care for, ensuring they are guaranteed the same statutory rights. In fact, all local authorities, under the provisions of the Act, have to deliver important things like information, advice and assistance to any carer who may need it, and have to make sure that carers are properly supported, both in their caring duties and in their personal well-being when outside of those duties. The Act dictates that carers should be given access to all of the information and the advice they might need, not just during their caring role, but also before it starts. All carers also have the right to be assessed for potential support needs, and support must be offered to those who fall under the eligibility criteria. Crucially, this must happen before any potentially harmful occurrence or emergency situation arises. This is key, as it recognises preventative services within the community so that any escalations of critical needs are minimised, and carers' own initial situations might be prevented from getting worse. By signposting carers to the right information and advice, authorities can empower carers to safely carry out their chosen caring duties and be in keeping with the overarching principles spelled out in the Act. So, what are the Act's overarching principles as they relate to carers? First of all, a carer must be deemed to be willing and able to provide care for the person or people they are caring for. By willing, it is meant that a person doesn't legally have to provide care or assistance to another person who is ill, older, or is disabled. It is their choice to do so. And that choice also includes which elements of caring they are willing to do, and which elements they are not. The areas that they are unwilling or unable to cover must be covered by local authorities, who will have to assess the care needs of the person with needs, and, if eligibility conditions are met, must then provide services and support in accordance with the legislation. For more information on what a carer's needs assessment entails, you can follow the link in the description box below. The Social Services and Wellbeing Act places a distinct, strong emphasis on the concept of well-being and uses it as an indicator to measure how effective the support a person receives is. Well-being, the Act says, is about more than just positive health outcomes or being healthy. It may include things such as being and feeling safe, having somewhere suitable to live, being involved in all decisions impacting one's own life, having friends, being part of good, strong communities, being given the chance to thrive in education, feeling positive about one's own life, and being able to work and contribute positively to society. The Act's provisions and principles encourage carers to make their voices heard and to exercise control over the outcomes that help them achieve well-being. It advocates the use of co-production methodologies in the design and delivery of services directly affecting carers. This points to the important notion that health and social care providers, local authorities, and any other partner exercising duties under the Act should not only consult, but actively involve all carers in the creation and delivery of care processes, or in any service provision directly relating to them as primary carers. For more information on the principles of the Social Services and Wellbeing Act, or for support and advice on how to help carers realise their rights enshrined in Welsh law, visit our website by clicking on the link under this video or give us a call. The number is in the description box.